Obesity can be really harmful to our health in a lot of different ways, but a new study suggests tonight that it may be the most taxing on the heart.
Yeah, and data shows Black Americans in particular are at a higher risk of dying from obesity-related heart disease. Our Dr. Frank McGeorge is here with the new research that finds the problem is only getting worse. Doc?
It is only getting worse, Karen and Damon. You know, this is a trend that so many people would desperately like to see reversed. Obesity has become a global health crisis, but here in the U.S., about 42% of Americans are now considered obese, and that is having a heartbreaking impact on our health.
Obesity is hard on the heart, and new research shows rising rates of obesity are leading to an increase in deaths from heart disease. A study published in the Journal of the American Heart Association found between 1999 and 2020, deaths from obesity-related heart disease tripled in the United States. This graph shows the increase divided by race. While all groups experienced an increase, look at the gray line. That represents the rise in obesity-related heart deaths in Black people. They suffered the most, followed by American Indians and Alaska Natives, shown in blue. There are gender differences as well. In the study, Black women suffered the most obesity-related heart deaths overall, but men, represented in blue, lead the way in all other racial groups. Obesity can damage the heart in multiple ways. It can cause cholesterol levels to rise, leading to clogged arteries. It can increase blood pressure as the body is forced to work harder to move more blood around. Obesity also increases the risk of type 2 diabetes and sleep apnea, both linked to heart problems. And obesity can cause increased inflammation in the body and the odds of developing an irregular heartbeat. It's a ripple effect of risk that only seems to be growing worse.
Now, experts point out the elevated risk in Blacks is also likely being driven by poorer access to medical care and other social determinants of health. Frankly, the pandemic also accelerated weight gain in a lot of people.
Yeah, so Doc, what's the solution? Clearly what's being done isn't working right now.
Well, you know, so this is a multi-layered, complicated problem. And frankly, as a nation, we need to eat less and move more. That's kind of really part of the bottom line. We also need to intervene a lot earlier when people are gaining weight, because we know, of course, that once you gain the weight, it's really hard to lose it. And a lot of people also believe that medications also play a big role in the future, particularly if they are proven to reduce cardiac risks.
Making those daily choices every day, too, in terms of diet and exercise.
Most important thing.
Life change.
Exactly.
All right,
Thanks, Doc.
Sure.